Hello everyone, it's Dr. Brower here by myself today. Sorry for the delay in the video. I'm actually recording this today because of all the flood stuff. You can see that the couch is back, so that means we are back up front. Things are calm, the trim is done. Thank you all for being so patient. I still feel like we're getting back in a little bit of the groove of things, but I'm very excited for a calm, nonchalant week of just seeing patients. It'll be a nice breath of fresh air. But on this week, we are going to talk straight about the Webster technique. So you've heard me say it, you've seen it. I am Webster certified, and that is super important when you're considering to get adjusted while you're pregnant. Excuse me. Because it's an extra technique on top of your normal adjustment, and it's just really sets apart pregnancy care. So I wanted to kind of explain Webster technique so you knew a little bit about it, and then we can kind of go into deeper things a little bit later. So I'm just going to kind of go over Webster technique itself today. If you have any questions, you can bring them to your appointment. You can comment, message, and I'd be happy to go over them in another video. But the Webster technique is a 6-step protocol surrounding just your hips and pelvis. So there's 3 things on the back that we check, and there's 3 things on the front that we check. They all are very important in regards to baby positioning, mom's alignment. All of it kind of works hand in hand. It's not really separate. You can't have one without the other. They really just go together. An important precursor to this video is you will never, ever, ever hear me say that I'm turning a baby, because I'm not. My goal is to just make sure mom's pelvis, ligaments, bones, all the things are in the best possible alignment so that baby can have the best possible positioning for them, as possible. So I will never turn a baby, but I will do all the things I can to help mom structurally to get that baby into a better position. So the first thing we're going to check is your sacrum. Most people know this as your tailbone. Fun fact, it actually only has about 2 degrees of movement, which doesn't seem like a lot until it's not moving. So your sacrum should move with every single step you take, and if it's not moving, that's the problem. So we want to make sure that that's moving. Further on, when you get in your pregnancy, as baby needs to descend into your pelvis, we need to make sure that that can expand like it should. Then I'm going to check your piriformis muscles. So those muscles start here on that sacrum and then insert on the real meaty part of your hip out here. They're part of your glute muscles. That muscle particularly is important because your sciatic nerve lives underneath that. In a little bit of the population, actually, your sciatic nerve can pierce that. So if that muscle is fatigued and tight and constricted, it can actually put pressure on that sciatic nerve, hence why sciatica is such a common pregnancy symptom. Not normal, common, there's a difference. Then I'm going to check a ligament called your sacrotuberous ligament. It's a big word just to mean that it connects your tailbone, your sacrum here, down to your sit bones here. If that ligament is tight, keep in mind this is very drastic, but it's going to kind of essentially pull these 2 together, and it creates like a shelf that baby has to kind of maneuver around. We want that to be soft and spongy, especially when it comes time for labor, so baby doesn't get caught on anything. It can really help move things along. So then we'll check the rest of your spine. That's traditional adjustment. Fun fact about me is you will never, ever, ever catch me putting a pregnant mom, I don't care how early, I don't care how late, on her side for a side posture. That's where you kind of like turn and twist your low back. Everything about the Webster technique, the goal of it is to put things in proper alignment and unwind them. So if I put you on your side, it's really doing the opposite. So you'll never catch me do it. Really, I won't do side posture on moms until they're about 6 weeks post-birth. So we'll check the rest of your spine using other techniques. Then we'll flip you over on your back, and the first thing I'm going to check is your pubic bone. So the very second you get pregnant, relaxin starts flowing. The goal of relaxin is to loosen everything up, but specifically this pubic symphysis right here. That's this cartilaginous piece in between the 2 sides of your pubic bone. This bone, or this joint bone, gets a lot of stress on it. Something as simple as getting in and out of your car. When you lift one leg, put stress on it. When you lift the other, puts unilateral stress on it. So it's really beneficial in pregnancy if you can kind of keep your knees together so we don't put excess stress on this joint here. However, sometimes things can shift higher on one side versus the other, forward, backward. This bone really does have a decent amount of movement. So we want to make sure that things are even and moving like they should. We can test your pubic bone in multiple different positions if it's something common that you're having. A common symptom of pubic bone dysfunction is fire crotch. If you've never had it, bless you. If you have, you know how uncomfortable it is. So we like to avoid that if we can get there. Then I'm going to check your hip flexor muscle. That's your psoas. That muscle actually lives on the front of your spine. Everyone has one. Some people have no issues with it. It's really common in runners to kind of struggle. And then of course pregnancy, because when we have our hips, it kind of just hangs out on the front of our spine. But as our belly gets bigger and our hips tilt forward, you can kind of hallucinate how it's going to stretch from the inside there. So we'll get in and kind of do a deep stretch on that. If it's something that's chronically tight for you, I can give you some stretches to at home. And then the last thing we'll check on both sides is your round ligament. That's the fun culprit if you're having that sharp shooting pain when you cough or sneeze in your first trimester, and then as things are stretching in your like second and third trimester. So we can do some technique to kind of help relax your round ligament, give you some stretches and exercises to do at home. I really, really love magnesium, kind of a light massage over your round ligaments. It helps loosen things up. But that ligament is super important the further you get along in pregnancy because it helps suspend your uterus in proper position. So if you're tight on one side versus the other, it can actually kind of pull things. Of course, these are all very dramatic. Remember, things work as a whole. So you'll never find me just checking one of these things and not the other. I check all 6 or I check none. There's no ifs, ands, or buts. It's just how it is. So if you have any questions about Webster, if you are pregnant, thinking about getting pregnant, let's get you under care. It's never too early to start this. People who have been in care their entire pregnancy, the stats are there to show that they do tend to have a quicker labor and delivery. So if that could be you, don't hesitate. Otherwise, same thing as usual, drop some suggestions for next week. Otherwise, Emily and I will be back at it to talk about whatever else we decide. I hope you all have a great week, and I want to thank you again for being so patient with us last week. It really takes a village, and you guys stepped up. So thank you again.